right, good. Yeah, keep your eye. Howdy doody. Hi, John. Howdy doody, tootie.
Why do I even come over here? I have to deal with this shit.
What's going on, John? You look upset. What's on your mind?
Not much, man. There's not a lot going on in here.
Inside that brain?
No.
It's empty?
It's
It's vacuous?
it's just a quiet place.
I guess
People
that's
were like, "How you
good.
doing?" I'm like, "I really have no idea. I haven't even considered
Yeah,
it."
you're just young. You don't know anything.
Yeah. that's a lot of it.
Welcome to the Move with MOTUS podcast. My name is Dr. Christopher Ellis, and joining me is personal trainer John Williams. We are the owners of MOTUS Personal Training and Physiotherapy. Together, we will discuss any topic you can think of when it comes to training and rehab. From the carnivore diet to hip impingement, you can be sure that all your questions will be answered. Enjoy this week's episode. All right, what are we getting into today? Is today the day?
For what?
You know what? It's the hip.
Yes.
Okay.
I guess that was on your mind more than it was mine, but I guess we're going to talk about hip and
I was trying to lead you into it.
I knew where you were going,
Yeah.
but all I had to do was send you the bounce pass
Yep.
for you to just make the easy layup.
Yep.
You know, we had a breakout down court, and I was like, no, absolutely
you're just
not.
teasing me.
Yeah.
You're the guy's like fake checking the ball, you
Yeah.
know? That's you. So, you get some painful hips, don't you?
Yeah, not a lot of hip impingement, though. Not now.
I thought you get pain in the front of your hip when you squat.
That's been going away.
What have you done differently?
Mobilizing my hip flexors.
Interesting.
ankles.
Okay. Hip flexors. Okay. All right, hip impingement, people. Here we go. FAI, femoral acetabular impingement. Super common, I'm finding. This is one of those
This
ones.
is when like your shoulder kind of hurts, right? It's like you get like a searing pain down your arm.
Except for a hip.
Oh, right.
There is a shoulder impingement and there's a hip impingement. Shoulder impingement, well, there's different types, but typically it's more muscular. It's usually a rotator cuff being pinched inside the joint, whereas this tends to be more of a bony morphology. Okay, so there's, if you picture a ball and socket joint, there is sort of like a bony growth that develops somewhere. So if it develops on the neck of the femur, so your thigh bone, that becomes what's called a cam impingement. And if that bony growth develops on the acetabular rim, so the socket, that's a pincer impingement. And most commonly it's you can have both of them. And by the way, if you have one hip, you're probably having the second hip. All right, we don't fully understand this, and this is one of those diagnoses that as a physical therapist you get, you're like, oh boy, it's one of these. It's hard to deal with because you're not going to change the bone, obviously, right? Without surgery, and the surgical success rates are like 64%. They're not great. So this is a population of patients that are desperate for answers. They have a lot of pain. It hurts to sit, hurts to squat, hurts in the front of the hip, and the hip flexor is always blamed. And sometimes it is a hip flexor, but more often than not, it is not the hip flexor.
Yeah, I would bet with people who are typically in this situation, it's not going to be that.
Yeah.
Just to describe, and you tell me if I'm wrong, because I'm just basing this on my understanding of biomechanics. The reason I would expect I would have some discomfort, like that little pinching in the front, as a result of my hip flexors, and then when I stretch them out and then I go to squat again, it sort of alleviates, is because of that positioning of that femoral head inside that socket. So when you have any sort of imbalance of musculature, whether it's tightness on one side, weakness on the other, so on and so forth, that's going to move around the position of that femoral head. So if it's the tight, quads and hip flexors on the front, just going to pull it forward, and then I try to go to squat, and then I'm getting jammed up because it's already in a bad position moving forward. And then as I go down, I have less room to actually go into flexion.
Yeah, I don't know. Maybe you just do have a hip flexor issue, or maybe you're getting lucky and centering that ball in the socket. It's hard to say. This is where, some testing really helps. So there's a test that I pretty much heavily rely on. It's called the FADER test. So it stands for flexion, adduction, internal rotation. So what that really means is if you picture, if you were to shave the back of your calf, the position you have to go into, so Your leg has your knee is bent, so that really means hip flexed, and then you adduct your leg, so your leg kind of comes inward, and then you basically internally rotate the leg to get to your calf. That's basically the position of the Fado test. It's kind of hard to describe, but that's the one that basically most people are going to have a lot of pain with. So hip flexion and internal rotation together. Sometimes it's the other one, Faber, which is the opposite. So it's flexion, abduction, external rotation. So picture sitting with one leg crossed over the other. That's external rotation. Those are pretty much the two big tests. There's a log roll test where you can take someone's leg and roll internally and externally, and that will usually provoke it too. Anyways, that's how you figure out what it is. Usually, if it's passive, it's internal. So in other words, if I move your leg into that position, you're relaxed and it still causes you a lot of pain, it's probably the joint, and it's probably FAI. If you're moving, it's only reproduced with active movement. It could be muscular. It could be both, but it could be muscular. So that's one sort of differentiation. So it's a very challenging one. You can definitely get an image. You'll find out the answer real fast. But I also have found, too, that the source of the pain is not always the actual bony morphology. Sometimes it is like buttock pain from the glutes or something like that. So this is like highly complex. So let me stop right there. Any questions yet? I know I kind of went down a rabbit hole, but...
Nope.
Okay. So
I'm really smart, so there's not much you could say
yeah,
that's going to confuse
that's true.
me.
I know it's hard to impress you. So, so etiology. Why does this happen? Okay, we don't 100% know. Congenital, maybe. Are you born with it? Maybe. There's a couple things. There's something called SCFE, so slip capital femoral epiphysis. So that means that as a growing individual, where your growth plates are, if you put too much force through that, the head of the femur, the capital, will start to slide downward at the level of the growth plate. So picture a femur, and then off at a 45 degrees, the neck, that's where the epiphysis is, that's where the growth plate is, and then the ball is just beyond that. So this happens more in boys that are a little heavier. So just the downward pressure, this is the theory at least, of their torso on the ball can cause a little bit of a shift. And then as that thing ossifies, it turns into what, it basically is a cam deformity. And the reason cam deformity is bad is as you rotate and heavily rotate, you're scraping the labrum, and you get labral tears. Some people live with this and they're fine if they're just walking around doing everything. But if you're into sports or into jiu-jitsu or horseback riding seems to be a big one. Anything gymnastics where you're exposing the end ranges of hip internal external rotation, that seems to be what makes it rear its ugly head. And I think it's because you're taking a bone, scraping against the labrum in extreme internal or external rotation. So that's one thinking, is that maybe the SCFE is the culprit. Another theory is that capsular laxity can cause it too. So basically, a lot of gymnasts, particularly women, that do a lot of splits, you create too much laxity inside the joint, and basically you get a lot of friction, and then the body starts to lay down bone when there's friction. That's just Wolff's law.
See, I think this is a little off topic, but I think about the human body and what it was meant to do. I think we were meant to have pretty large ranges of motion.
Mm-hmm.
I'm not necessarily sure we were made to do that.
Like something like the splits?
Yeah.
Yeah, there's this, especially Instagram these days, it's all stretch and press, right? It's look how flexible I am. And it's yeah, well, okay, cool. But can you control that end range? And are you potentially causing some issues there? What is the value of doing a split? I mean, in the 70s, it was all about butterfly goalies. Going to the splits, that's about the only thing I can think of. Right?
Yeah, and in the wild, there's really no added benefit. But what there is added benefit of is having really great ranges of motion in your shoulders and being able to squat deep with a nice, flat back. I would say if you can do a really nice overhead squat, you feel comfortable in that position with the bar directly overhead and your butt pretty much as close to the ground as it could get with your feet flat on the ground and no lumbar rounding, lumbar flexion, you probably have all the range of motion that you need. That's my guess.
Well, so, as a general principle in the physical therapy world, it's you sacrifice stability for mobility and vice versa. Right? So the more mobile a joint is, the less stable it is. And the more susceptible it is to like a dislocation. Right. That's why the shoulder, we ask a lot of the shoulder because it's attached to our hand, and that's how we feed and dress and stuff like that. So the shoulder is inherently probably the least stable joint in the body.
Also, if you look at the joint itself, it's not like the femur, or not the femur, the hip joint, femoral acetabular joint, where it's like literally the acetabulum is wrapping around the femoral head.
Mm-hmm.
The glenoid fossa is like kind of a loose structure. It's just like it's just kind of an open, rounded surface that your humerus sort of rounds on, but it's not as enclosed as the hip joint is.
So we always say ball and socket. We're talking about the shoulder, and we do the thing where you make a fist and put your other hand over it, and that's how you demonstrate what a ball and socket looks like. But that's not really what the shoulder looks like at all. If it looks like the glenoid fossa is basically the socket that he's referring to, is the size of like a marker cap holding like a tennis ball.
Yeah.
So it's there's not a lot of contact there, and then you got the clavicle, and that meets with the spinous scapula, which forms what's called the AC joint. That also forms a little more stability and creates a little more of that sort of socket. And then you got sort of the rotator cuff that helps hold in place, and then you've got the capsule and the labrum. The labrum of kind of lines the glenoid, creates a little bit of negative pressure, kind of keeps the ball into the joint. That's why like a shoulder, like a slap tear, which is a labral tear, creates a lot of instability in the shoulder, because you take an unstable joint and then take one of the layers of stability out, like the negative pressure, and it becomes a very unstable joint.
Mm-hmm.
The hip, way more robust. It's like our prime engine. That's how I see it, right? So you don't really see a lot of dislocated hips. It happens, but not that often. But you get these more sort of internal bony issues with the hip. So, what else?
What's the solution for
there's not
these poor people?
It just totally depends from person to person. Another thing I see causing it is just muscular imbalances. So picture like the cartoon piece of meat on a bone that like the dog is eating, right? It's just like a big thick bone with a big circular piece of meat around it. That's what I picture the femur to be like. It's just a bone with a ton of muscle around it, right? You got your quads, hamstrings, glutes, all that stuff.
Hopefully for most people.
For most people,
but
right?
It's not. A lot of people got flat asses out there, Chris. It's true,
It's
though.
true. Yeah, I know.
And then you see people. I am generalizing, but this is what I see.
We call it FAS, by the way. It's flat ass syndrome.
Flat ass syndrome.
Yep.
I see people with this FAS, and so many of them are wearing some sort of knee brace.
Yeah. I mean, that doesn't surprise me at all, right? I mean, you could make the argument that the glutes are like probably orthopedically maybe one of the most important muscles. Wouldn't you say so? I don't know.
I would 100%.
I don't know if that's an important conversation, but it's I would say it's like one of the biggest holes in anybody's armor is glute weakness.
Everything changes when you engage your glutes, even in standing posture. Your thoracic posture changes. Your knees have to do different things. Your feet have to do different. Like, everything changes once you've engaged your glutes. But I want to say this: like you see a lot of these guys. I got a friend at the gym. He's this guy. He's got all these muscles. He's got these shoulders, chest, big arms. Then he's got these big quads, these big calves, and he wears a knee brace on one of his knees. FAS all day long.
Yeah, I would actually argue the two most commonly problematic areas of the body when it comes to all things ortho is flat feet and weak butt. Fix those two things, a lot of other things fall into place.
Yep.
So
I couldn't agree more with that, by the way.
Yeah, anyways, going back to sort of my cartoon meat analogy. So if you picture that bone attached to some muscle, and one side of the muscle has a lot of muscle tone or stronger, what do you want to say, and the other sort of quadrant of it, the reverse of it, in this analogy being the glutes, is weak. That bone is going to naturally be pulled forward into the socket. So very similar to like a shoulder impingement. Very commonly, you'll get a very tight pec, which attaches to your humerus, your arm bone, and weak middle lower traps, which would pull it back. You get that sort of imbalance, and then the ball comes slightly forward in the socket, and then when you reach your arm overhead, the rotator cuff pinches within the AC joint. That's really typical, really common. That's not the only cause, but that's super common. I think a similar thing happens too with hip impingement. You get like everybody complains about groin pain. They're stiff adductors. There's a lot of debate whether is the adductor being stiff and the glute being weak allowing the bone to slide forward in the socket, or is the joint unstable because of a labrum tear that typically happens with FAI, and then the muscles are guarding against that. We don't know the answer. I kind of suspect that it's the other one, where the glute is weak, the adductor's maybe overpowering it and pulls the ball slightly out of the socket. So this is where, this is why it's super nuanced and confusing, because you have all these different etiologies, and you have to really be thorough with your evaluation to find out, all right, are we looking at a stiff adductor and weak glute kind of situation? Are we looking at a laxity situation? And then you just have to address those things. Or
is it just a bony morphology that we have to just kind of work alongside?
Yeah, I mean, a lot of these patients will come in when they had their images and they know that they have a CAM or a pincer deformity or both. Then it's like, okay, now is surgery warranted? And I typically am thinking no. Let's see if we can center that ball in the socket. So that's where I usually start off after doing an evaluation, kind of figure out, I kind of form my hypothesis. Then I'm going to try to get that ball in the socket somehow. So that may be sort of some sort of banded exercises, like trying to pull the femur backwards. I'm experimenting too with pelvic tilt. Does anterior versus posterior make the hip feel better? There's a lot of factors into what causes those things. Maybe we can get better around that, the pelvic sort of angle towards the femur. And then it's, mitigate symptoms. So you're going to be doing some soft tissue work, especially on those adductors. A lot of times piriformis gets super fired up too. And then you're just trying to rebalance the system for the most part. And a lot of times it works out. I'll say that most of my patients that have FAI, I can get them pretty functional, get them to have big periods of relief where they have no pain. But it is going to resurface from time to time unless you're really diligent with your exercises, and you're going to have to do some soft tissue maintenance, most likely. So maybe you can do like a Theragun and take care of those adductors, keep that glute medius strong. That's usually the biggest hole is the glute medius.
That's even just for a lot of things in general.
Yeah. And there's more. I keep going. I'll try to keep this a little bit briefer. So there are a couple other sort of subsets of things that go along with it. There's a little muscle called quadratus femoris, which is right next to the piriformis, so your backside, that tends to stiffen up. There is something called subspine impingement. So that is where your rectus femoris, where it starts in the top of your pelvis there. So it's one of your quad muscles. It starts to avulse away the bone. So that's right where everyone points to, that pain when you squat in the front. That could be so many different things. Everyone just says it's hip flexor. Sometimes it is. But sometimes it's a rectus femoris issue, kind of pulling.
Yeah, and that's my thing, too. I shouldn't sit here and say I have hip impingement. It could be something else as well, because it's that pain in the front of the hip that you can just point to, and it could be a whole bunch of different things.
Well, in your case, if you have pain in the front, first of all, you can palpate hip flexor. You just do a straight leg raise, feel what bulges underneath, and you can pretty much guarantee you're on hip flexor. If that's the spot, then it maybe is your hip flexor. And if hip flexor stretching alleviates the pain, then that's probably what it is. Not always, but more often than not, it's usually something else in that area. It could be literally the bone getting pinched in there. It could be the capsule getting pinched in there. It could be a subspine impingement where you got a rectus femoris issue. That's where you have to test the length of the quad. It's super confusing. Sometimes you get this substitution pattern where your TFL, which is a muscle just beside your hip flexor, sort of overpowers and helps to pull the ball out of the socket a little more. So you got to look at what's the motor sequence going on here. And I should point out too, there's a lot of hip flexors. There's not just one muscle. You got psoas major, psoas minor, iliacus, rectus femoris, sartorius. All these things flex the hip. So just to say, it's my hip flexor is a little bit of let's throw some spaghetti at the wall and see what sticks. So
yeah, but that's kind of fun.
That is fun. Yeah.
Have you ever been in a food fight, like in a cafeteria?
No, but I caused a food fight once.
This is the end. This is the end story right here.
Yeah.
We're all done with the hip impingement, so you can cut it right now if you want. But this is going to be a good story. I can tell.
Let me just say, I know the people out there with hip impingement are desperate for answers. There's a Facebook group. Check it out. There's a lot of good info there. hit me up, chris@dynamicnaples.com, with any questions. I love talking about this stuff, obviously. Yeah, it's a tough one. Don't go rush to surgery. I will say that there's a lot of injections. A cortisone I wouldn't recommend. There's PRP. There's prolotherapy. Seen some mixed results. People tend to do really well at prolotherapy for whatever reason. I don't fully understand why. They inject sugar into the joint of all things. So dextrose, which triggers an inflammatory process.
Now, could I just get sugar at the store, put it in a needle?
John, no. So, I've actually been meaning to do a deep dive into prolotherapy because I want to understand it better. And actually, I'm going to be interviewing someone from from Prolo pretty soon. But I do know, like, sometimes, like, laser therapy, you're basically stimulating inflammation to kind of reboot the whole inflammation process. Or maybe if you over signal to the body that there's a lot of inflammation, the body will fight to cut it down. I don't know exactly the mechanism, but I just know that people that do Prolo tend to do pretty well. So it's interesting. All right, food fight, right? Senior year. Did you wait? Are you still in high school? Just kidding.
I'm happy you're saying that because I am young. I'm vibrant. I'm thriving in this life. So yes, all of those things are true. I do look like a teenager, and it's great. Anyway,
so senior year, so that probably wasn't too long ago for you. So we did like senior pranks, like every day towards the end of the semester, end of the year. For like a month, there would be like a different prank every day. It was like a tradition. Did your school do that?
No, we just had. I don't even. You know what? My senior prank, and I had no part of it, and I didn't even participate, was so embarrassing. I don't even want to talk about it. So continue on.
All right. Well, this is gonna be a little bit of a long story, so we'll save that one for the next episode.
Yeah.
So like there'd be pranks like. Wear your shirt backwards day or something. That wasn't one of them, but it was like stupid stuff like that. But then there was some that were a little more serious. There was the Naked Mile, where all the seniors would just get naked and put on masks and run past the cafeteria at lunchtime naked.
That's a good one.
Yeah. But then there was the big one, was the Kidnap Day. So that was where a senior would kidnap a freshman and basically make the kid truant for the day, and and usually it'd take him out to lunch or something like that. But there was this one class that kidnapped a freshman, and they chained him to a tree in the woods. And I think they kind of forgot about him, or it was just that he was there for a long time. Like the parents were like, "Where the hell's my son?"
It's a little excessive.
Yeah, and then it was like he could have been killed, and so the school freaked out and said, "No more Kidnap Day. If you do Kidnap Day, you're suspended. You're not graduating. That's it." They extreme measures, and warranted, obviously. So that day comes around, and they banned it, but it was still on the schedule, right? Because we had a little senior newspaper and all that. No one was really daring to do it. Now let me set this up a little better. So at this high school, we had freeze. So if you remember, you had study period. You had an hour. You didn't have class. You could do whatever you want, but you had to stay in school. I think juniors and seniors, when they had a study period, you could get a pass and you could leave the campus and go to the gas station. That was the cool thing for whatever reason. We just had to have a pass, right? A free pass. So there was a kid in our class, Josh Rubel. If you're out there listening, what's up, buddy? He was short for his age and kind of small and thin.
But he's much taller now and he's very good looking.
He's probably short. I don't know. Rubes. Anyways, so this is what happened. It's lunchtime. All the teachers are on high alert. They're all in the cafeteria. They're all walking around, vigilant eye. My buddy had one of those old school Volvo wood station wagon things. You remember those things? So he pulls up, kind of comes in hot, and peeling in, and stops right in front of the big windows. These are floor ceiling windows by the cafeteria. Everyone's out. The whole school's there. All the teachers, principals, everybody's there in front of the cafeteria, inside the cafeteria. We pull up right beside it so everybody can see. And then, I played hockey, so I had a hockey bag, right? So me and three other guys are carrying this hockey bag, kind of shuffling fast as we can to the car where my buddy Matt pops open the trunk. Clearly, we're carrying a body inside the bag, right? Because it's four dudes carrying a hockey bag. The bag's moving around. And we're and we throw it in there. Teachers see what's going on. They come flying out. They're like, "That's it. You're never graduate." Blah blah blah, and they're freaking out. And then they unzip the bag. There's Josh Rubel, a senior, right, with his free pass stuck to his forehead. And they're just like, "Oh." So then we're just dying. Like they're kind of like, okay, got us. But then Harry Donovan, who was like the troublemaker of our class, we hear him just go, "Food fight!" Because basically all the teachers had left the cafeteria to
And then
berate us.
everybody's just
The entire school is in there like unattended, and we just hear a table flip upside down, and then a big like chocolate milk container hits the window, just splashes. Like it was a mass food fight. It was awesome. So we didn't get in trouble for the kidnap day, but they blamed the food fight on us. So they suspended us for a day, and we had
that's
to
unfair.
we had to like paint the score box on the football field. That was our 1 day suspension.
Oh, that's unjustified right there. You didn't say food fight at all.
Yeah, I know, but whatever. We were seniors. We didn't care. Like a day off just to paint something. Whatever. Cool.
Fair enough.
Yeah, and we just felt like we won today.
That was a good one.
There you go. You're welcome. All right. Well, any other questions about FAI?
Nope.
Check out my YouTube channel. I've got a lot of videos on it. And again, just hit me up if you have questions. I truly do love talking about it. It's kind of my niche. So Chris at dynamicnaples.com or find Instagram at dynamic.pt. All right.
Sweet.
Cool. All right, John, I'm tired. Let me go home. Oh, yeah, I'm home. That's right. All right. See you next week. Bye.
Okay, bye.
Do you have unexplained pain? Or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great way to stay ahead of any health conditions. And now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's liver function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It's sent to you with free shipping, and you get results in 2 to 5 days, no physician referral needed. Use the code DPT20 for 20% off. Go to letsgetchecked.com and use the code DPT20. Thanks for listening to our podcast. If you have any questions you want answered, find us on Instagram at MOTUS Naples or send us an email. You can fill out a contact form on our website, which is motusnaples.com. Make sure to check out our blog and our shop as well, where there are downloadable programs that we'll continue to update. This is the Move with MOTUS podcast. We'll see you next week.